Don't you just love debates? Got a good one for you. Ice versus heat. Which one do we do? A lot of people don't know. They don't understand the fundamental difference between and what each one's targeting towards. Let's talk about ice. What does ice do? It's cold, isn't it? It constricts. You put, say, ice on your arm, the erector pili muscles, or the little erector pili, your hairs stand up on end, don't they? So there's some constriction, there's contraction when we put ice on. So what's ice good for? Great for intramuscular bleeding, so if you tear a muscle or if you roll an ankle, if there's anything where there's a likelihood of bleeding, ice is the only thing to do. Obviously see your doctor first, get it assessed, get it scanned, make sure that there's nothing broken, and if you need a brace or if you need something or other else, then please do it. But with respect to ice as a generalism, if it's red, if it's hot, if it's swollen, or if there's bleeding potentially around, ice it. They're the major contributors, or the major functional things that we look for and isolate for to say, ice, this is what we do. So it vaso-constricts. Vaso, what's vaso? The blood vessels, it's going to constrict them. So if the blood vessels were opened up and if there's a wound in there, you're going to bleed a lot more, aren't you? If we can constrict them, it helps coagulation. Coagulation is where the blood clots and the wound heals over. So we want the ice to take some of that out. The red, the hot, if we can lessen the red, if we can lessen the hot, the swelling goes down a little bit, or we can isolate the swelling, we can manage the swelling, we can maintain it better. Then with compression bandages, rest ice compression, elevation, that can again help to facilitate. The first thing that we want to do though is ice, and normally again, like a lot of things, there's a lot of conjecture over what we do or what we don't do. By what I would do personally is I'm icing for 20 minutes on, 20 minutes off. You don't want it to get frosted, you don't want it to get too cold where you lose sensitivity or you can create an ice burn. So it's very important that ice is good, but ice can also hurt you. So just be aware that too much is not that good either. And if you want to limit again the impact ice can have on your skin with an ice burn, wrap it in some cotton or something like that, a tea towel, or some people just put it in a plastic bag and then they can rub it up and down on an area as well. And with a plastic bag, you can also mold it in and around an area, unless you're lucky enough to have a joint specific bag that with the Velcro straps that's made for that joint. Heat. So what does heat do? Heat does the opposite of vasoconstriction. It vasodilates. Dilates, it opens up. It expands, it allows blood to move through easier. So if something is really tight, so if you're just a little bit stressed out, if you've just had a hard workout, you've overworked but you haven't torn anything, then I would look more at heat. If you're feeling a bit fatigued, then heat. Because heat will open things up, it just allows blood to flow into an area a lot better, and it helps us to relax a lot more. Going back to the ice, lovely going backwards and forwards, isn't it? If you actually do tear something, or if something bad happens, normally you'll A, feel it, and B, you'll hear it. So you'll feel it and hear it. What are you going to feel? Normally a ping, unless it's really bad. So one of my athletes tore 2/3 of rec fem. Rec fem is a major quadricep muscle. That went off like a rifle, and that athlete went down on the ground, and it was the first and the only time I ever saw them cry. So if something like that's happening, we get them to a doctor and we get them to them as soon as we can, and we look at what sort of intervention is required from there. But your normal stuff, your average stuff, ice or heat. Vasoconstriction, vasodilation. So if we're not icing it, then heat is the better option. Keep it moving, open it up, and probably look at your posture as well, because if you're getting sore and if it's not through injury, it's normally indicative that the muscles are out of balance, say from one side of the body to the other. So most of us are too short, too strong here. We're too long, too weak at the back, so we either are like that or we end up like that, which, that's just bad posture. The more upright we are, if our head sits over the top of our shoulders, it allows certainly the use of heat to be less, because we're not stressing ourselves as much physically.